Hello and welcome to today's episode. I'm Dr. Asha Albukakpai from the Department of Social and Health Innovation, and today we are going to dive into an incredibly timely and crucial topic, One Health. This approach recognizes the deep interconnection between human, animal, and environmental health, and it's a subject that's gaining a lot of global importance and momentum in today's light of health challenges. To help us unpack this topic, I'm joined by a remarkable guest, Dr. Navya Vyas, from the Department of Global Public Health, Policy and Governance, Prasanna School of Public Health, Mahe, Manipal. Dr. Vyas, welcome to this podcast.
It's a pleasure to be here. Thank you.
So, Dr. Vyas, let us start with the basics. For those of our audience who are new to this concept, could you give us a little introduction on what One Health is all about?
So One Health is a concept which has been there for more than a century. It talks about the interrelationship between the human, animal, and the environmental sector. So it actually re-emphasizes on the idea that, all life is equal and everything is important. And definitely it is a framework which helps us understand many of the global health risks, like, the zoonotic diseases. Like when I say zoonotic diseases, it means diseases that have an origin from animals. We talk about antimicrobial resistance, the food and nutrition issues, and climate change. So it is a very important framework, which is an important aspect of health system strengthening and hence a very important part of global health security.
That's fascinating. So One Health emphasizes on the interrelationship of many experts from different disciplines, isn't it? So in your experience, what do you see as the main challenges when it comes to implementing a One Health framework?
Okay, so before I talk about challenges, maybe it's important that, we also take note of some of the positive things that have happened over the years, because like I told you, the concept is old, but we have had a lot of initiatives at the national level, at the global level. And according to the evidence that has been evolving, like, related to, let's say, about the antimicrobial residue. So we have seen that there has been changes also at the policy level. So where they have introduced this, like, AMR residue has to be considered like in the food animals and, the food products that we use. So that is one important thing. Even One Health, they have started introducing in some of the curriculum in medical schools, in some basic courses. So that is some of the positive aspect that we have. And challenges, well, definitely some of the One Health networks, most of it is mostly concentrated more in the high income countries. And most of the problems actually happen in the low income countries. But not outrightly saying that, the One Health networks are not there, but comparatively the numbers are very less. So that kind of, that equal distribution is not there. And also we have the challenges related to human resources and financial issues are always like, something which act as a challenge for this area.
Interesting. Perhaps to make it a little clearer, could you give us a real life example of, how it's actually been put to use in various countries or in our own scenario?
So the One Health approach, one effective example is what happened in Goa, where the rabies cases, like it's not reported anymore over there. So they had a very integrated One Health approach, where one of the component was, the vaccination of the dogs. So that was a big challenge because if it's under ownership, it's easier for them to access. But like the stray dogs was always a challenge. So they use a smart technology for that. That's one thing. And another thing that they did was related to the surveillance for the dogs because, they were concentrating more on the dog-mediated rabies. So they actually started off with like a hotline number and where people can call in and report about the cases, like if they suspect anything or if any people are affected by it, so that they can take immediate action related to it.
And that brings me to the topic of climate change, which seems to be a huge part of this entire puzzle. So could you elaborate a little bit on maybe the role of climate change that plays, or the role climate change plays on One Health framework?
So actually over the years, like deforestation, urbanization has all been reasons for the climate change, like to widen the roads, we cut down the trees. So what we fail to understand is that, the habitat of the animals are getting disturbed. Right. And they also are trying to actually change with this evolving environment. So there are changes that are happening within them. That is one aspect. So, and when the interaction between humans and animals happen, the spillover of the diseases happen between them. So that is one aspect. Another one is the food and nutrition security issues that have been related to it. Yeah. And also it's not just like on the land, under the life underwater, like the marine ecosystem is also getting affected because of the increasing temperature. and it's actually causing a lot of irreversible damage to the ecosystem.
Wonderful. Perhaps you'd like to tell us a little bit of what PSPH is doing in the One Health scenario.
Well, we definitely have a center for One Health. So that is one thing that we have set up like even before the pandemic. And we have also had a lot of training sessions. And recently we have come up with some training modules for the field level staff.
Wonderful.
And also like that includes like water health and, the animal husbandry for the ASHA workers, the para-veterinarian staffs and all the field level care. And we're also coming up with some modules for the medical officers and the veterinary doctors, along with case scenarios, which I hope will help in strengthening the health system.
That's wonderful. Thank you, Dr. Vyas, for such an insightful discussion. I think it's very clear that One Health is not just a framework, but it's a movement towards a more integrated and sustainable future for all, I think. Thank you to all our listeners for joining us today. Remember, health is interconnected, and the actions we take today will definitely shape a healthier world tomorrow. So until next time, stay safe and stay informed.